So there's a lot of valid concern these days that our technology is getting so smart that we put ourselves on a path to a jobless future. And I think the example of the self-driving car is actually the easiest one to see. So these are going to be fantastic for all kinds of different reasons. But did you know that driver is actually the most common job in 29 of the 50 US states? What's going to happen to these jobs when we're no longer driving our cars, or cooking our food, or even diagnosing our own diseases? Well, a recent study from Forrester Research goes so far to predict that 25 million jobs might disappear over the next 10 years. To put that in perspective, that's 3 times as many jobs lost in the aftermath of the financial crisis. And it's not just blue-collar jobs that are at risk. On Wall Street and across Silicon Valley, we are seeing tremendous gains in the quality of analysis and decision-making because of machine learning. So even the smartest, highest-paid people will be affected by this change. What's clear is that no matter what your job is, at least some, if not all of your work is going to be done by a robot or software in the next few years. And that's exactly why people like Mark Zuckerberg and Bill Gates are talking about the need for government-funded minimum income levels. But if our politicians can't agree on things like healthcare or even school lunches, I just don't see a path where they'll find consensus on something as big and as expensive as universal basic life income.
I want us to start by thinking about this device, the phone that's very likely in your pockets right now. Over 40% of Americans check their phone within 5 minutes of waking up every morning. And then they look at it another 50 times during the day. Grown-ups consider this device to be a necessity. But now I want you to imagine it in the hands of a 3-year-old. And as a society, we get anxious. Parents are very worried that this device is going to stunt their children's social growth, that it's going to keep them from getting up and moving, that somehow this is going to disrupt childhood. So I want to challenge this attitude. I can envision a future where we would be excited to see a preschooler interacting with the screen. These screens can get kids up and moving even more. They have the power to tell us more about what a child is learning than a standardized test can. And here's the really crazy thought. I believe that these screens have the power to prompt more real-life conversations between kids and their parents.
The things carers do for their patients are varied. They provide personal care, like getting someone dressed, feeding them, helping them to the bathroom, helping them move about. They also provide a significant level of medical care because they often know a lot about their loved one's condition and needs, sometimes better than the patients themselves, who may be paralyzed or confused by their diagnosis. In those situations, carers are also advocates for the patient. Also of critical importance is the fact that carers also provide emotional support. They organize doctor's appointments, they manage finances, and they also deal with daily household tasks. These challenges are challenges that we can't ignore. There are currently more than 100 million carers providing 80% of care across Europe.